remember it because it was Friday the 13th. And we know that that number now has increased dramatically, both in Milwaukee County and the city of Milwaukee, where we're over, I think, 1,700. We'll get the exact figures later in the county, and well over 1,000, probably 1,200 here in the city of Milwaukee. And the deaths have risen during the same period. So in just 1 month, you can have an understanding now why this is considered such a serious pandemic, and why our message day in, day out, has been the same, that you're safer at home and we're asking you to be at home. I do think we are beginning to see some signs of progress in the number of deaths that we're seeing, and others will talk about that today. But we also know that we are nowhere near out of the woods in terms of what we have to do to get our society and our city back to normal. And I think that is obviously the goal for every one of us, is to get back to normal as quickly as we can, and to resume our jobs, resume our lives, be able to enjoy the sunshine, and to get out and do the things that we love to do as Milwaukeeans and Wisconsinites. But right now, our job as citizens remains the same: to continue to do the social distancing, and to do it not just for yourself, but to do it for other people that you love, people in your family, so that you don't infect them, your neighbors, your friends, and other community members. So as a community, to see whether we can do it. And as I look at where we are as a state, about 3 weeks ago, we were probably 17th in the country in terms of the number of cases that we had. We are now down to 24th. And so in a strange way, and I don't want to say misery loves company, but there have been a significant number of states that have surpassed us in the number of cases that they have. And I think a big part of that is the fact that we have been falling in those rankings is because of the social distancing that we've done. My experience has been that people have really complied with this in a very, very significant way. And I'm extremely thankful, because I think it's showing results, and that's what we want to do. We want to make sure that we flatten this curve, and then we want to make sure that we are completely squashing this curve, and that we will be through this and can resume life as normal. On the logistic fronts, we'll be hearing from Deborah Stanridge and Celia Shaughnessy. There's a lot of progress that's been made with the alternate care facility. I want to stress this over and over and over again, that this is in essence an insurance policy, and it's an insurance policy that we never have to use. But I would much rather take the criticism that we put the money into doing this, and this is money that's coming from the federal government through FEMA, through the Army Corps of Engineers to the state. So it's coming out of the allocation that the state is receiving, and I'm very thankful to Governor Evers and his team for doing this. But what we've done, and this was something that was intentional, we wanted to make sure that there was a first-class team that was running it. And Deborah Stanridge and the others that are involved in this have an extensive history in healthcare in southeastern Wisconsin. And so I have great confidence with them. The site is beginning to take shape. I think that that's very, very important. And it's moving at a very quick pace. But I hope it's never used. I hope that there are more workers that are building it out, that there will be patients who use that. If that happens, it means that we have been, the flip side of that is, I would much rather be in this situation than 2 weeks or 3 weeks or a month from now having people say they weren't prepared. We are preparing for the worst, and we are hoping for the best. And this would not be possible if it weren't for the tremendous cooperation that we are getting between communities, between the city and the county, between the city, the county, and the state. Everyone recognizes what's at stake here. And I want to thank the County Executive Abley, once again, for the work that he's doing and his team is doing, so that we can make sure that we're doing what we all need to do for our constituents. So with that, I'm going to turn it over to County Executive Abley. County Executive.
Well, thank you, Tom. And I know, as the mayor said, there has been some reason in looking at the numbers to think, okay, well, it looks like the number of new cases seems to be decreasing daily, but it's a short pattern. And as also, as the mayor said, anytime you're seeing, we as a state are seeing any progress, the reason we are seeing progress is entirely because we're being good about the social distancing, we're staying home, and we're staying safe. And if we relax on that, we can see, and I said this before, as other communities have when they relax too soon, a resurgence. And we don't want to see that. We would love, as the mayor said, to have a brand new and empty surge facility that doesn't have to get used. But it will get used if people feel like they can relax too early. And I think that's a point you're going to hear about a bit more from other folks. And it's been great working with the city, with the state, with our congressional delegation. We have a lot of folks who agree on one thing. We want to save as many lives as possible. We want to get back to normal, get the economy started as soon as we can safely and responsibly do it. And we also want to make sure that the state gets as much of the federal support and resources that are coming out as we can. That's something we're very aligned on. And we have worked together on this. Just quickly, just an update on transit. I've given a few updates in the previous sessions. As of this morning, MCTS buses that run Monday through Fridays have resumed using a regular weekday schedule. For the past couple of weeks, we, as you may recall, had begun to a Saturday schedule, even on weekdays, because volume was down. But again, we're going to go back to, as of this morning, a regular weekday schedule, which means that there'll be more frequent buses on the routes. But please note, all the freeway flyer service, U-bus service, and school trips are still suspended. And again, as I say every time, the bus is there for essential trips. We're doing absolutely everything we can to make sure that it is there and it is safe for people who have essential trips to make for essential services, jobs, or healthcare, that sort of thing. But again, should only ride the bus if you're headed to an essential job, a critical location like a hospital, a grocery store, or a pharmacy, and no leisure riding, loitering, or sleeping is permitted. That may seem like it goes without saying, but I'm just making the point to reiterate it. Again, we have maintained the cap on 10 passengers per bus. And so if there's 10 passengers on the bus and they come to your stand, they're going to keep going. And that's not to keep you late, that's to keep you safe. But the good news is the next bus should be coming soon. And obviously don't ride the bus if you test positive. And you're going to continue to enter and exit out the back door. Only unless you have help with a mobility device or ADA, and then you can be patient and our folks will work with you. And that's essentially what I've got. But, a lot of us celebrated in a very interesting and different way this past weekend, Easter and Passover recently. And, one of the things we tend to do in these holidays is we realize the commonality between all of us as a race. And we remind ourselves of the importance of compassion and love for one another. To me, the most effective way that we beat this pandemic, and we will beat it, is to think that way towards all of our fellow citizens and do everything we can to help them stay safe. And that means, for the time being, staying home and social isolation. So with that, I will turn it over. I'll turn it back to Brian, I guess. Or is it to Commissioner Kowalik?
Yep, Commissioner Kowalik.
Oh, yes, Dr. Weston's not available. Congratulations to him and his family. Thank you for the opportunity to provide an update today. Hopefully everyone that celebrates the holidays over the last week and weekend had a very pleasant time together in your homes. But we know that some people may have snuck out and spent some time with some family members. So I wanted to just highlight that as we're looking at the map and we're looking at the numbers and a potential flattening, we need more time. There's three factors that we should be paying attention to. One, looking at time as a factor in general, because you need at least a week to see a consistent pattern here. Next is looking at the election activities. So Tuesday will be the 1 week mark since the in-person election. So as the governor's office noted in the Department of Health Services, that there is additional surveillance activities that are underway to look at in-person election activities if someone is a case or a contact of a case. And then lastly, like I noted, if anyone dipped out or spent a little bit of time with other family members outside of their house, they may have been exposed to COVID-19. So, just look for the next 2 weeks to see if numbers continue to flatten or if we'll see a spike. We're hoping for the best, but we also acknowledge that the election activities definitely set us back on our path. We also have received a number of questions about the order, the safer at home or shelter in place or safe at home order, what's happening with that. Right now, it's still scheduled until the end of April, and this will be evaluated closely to see if there needs to be an extension. So more to come on that. There's a lot of math going on to figure out if the projections are on par. I know the business community is itching to get back to normal, as well as many of us in our community here. We love springtime in Milwaukee and summertime in Milwaukee and all of the festivals and great things that we have in store. But we can't rush back into normal. There has to be some phased approach to make sure we are not setting us back on a path to another surge of COVID-19 infection. So another thing I want to talk about is mask wearing and face covering. So I've seen a few people violating what this should look like, and I just want to show everybody what it needs to look like, just so we can all be on the same page of what is really going to help protect you from COVID-19. Again, it's spread by droplet, which is a little bit different than airborne or aerosol, where it's more of a mist. Droplet is like a heavier, denser type of water or fluid. So I have my mask here because, I like funky patterns. And this is a cloth mask. You wear it one time. After you wear it, you're supposed to wash it right away. You don't touch it, but you put it on one ear. You don't touch the middle. And then you put it on the other ear. You make sure it's down so your nose is covered and your chin is covered. I've seen a lot of people just covering the mouth. What's the point? Or they have a beard and the beard is like just out, and that's also problematic too. This is why the CDC initially had issued guidance about mask wearing, about cutting beards. And I know that that's very difficult for some people. There may be some religious or philosophical reasons for having a beard, but the beard can also prohibit or interrupt with your ability to wear a mask or face covering properly. So I just wanted to show that to everyone because we've been getting more questions. And I'm seeing more and more pictures of people wearing face coverings and masks, but I just want to make sure we're doing it the right way. And lastly, I want to highlight where we're at. So City of Milwaukee, 1338 cases as of 2 p.m. Milwaukee County, 1773. As far as fatalities, 86 at the county level, 65 in the city. We're still seeing this disparity. Unfortunately, 63% of fatalities are African American. As far as cases, 56% are African American, 22% are white, and 15% are Latinx or Hispanic. As far as age is concerned, 33% are individuals over the age of 61, which we know is a high-risk category, as well as those with underlying health conditions. Also is looking at gender, 53% are female and 47% are male. And then lastly, when we're looking at the map of Milwaukee County, where are we seeing the most cases? And 53216 and 53215. So north side, now south side are the hot spots for cases. And then 53209 is second for cases. So we are working and looking at other partners across the city and county to really bump up outreach in these areas to prevent the spread of COVID-19. There will be additional testing opportunities as well. That should be addressed later in the week. But again, this is all hands on deck, and we can focus more on getting back to normal if we make some sacrifices in the short term, staying at home if at all possible. If you don't have arrangements or the ability to stay at home, please call 211. The health department can help connect you to resources, whether it's a hotel room or staying at the facilities that we have set up. And then on that note, I'll transfer this over as we talk about another alternative facility that is underway. Thanks.
Thanks, Commissioner Kowalik. Next, we're going to hear from Deborah Standridge, who is the CEO of the Alternative Care Facility at State Fair Park.
Thank you, Brian, and thank you for the opportunity to be able to be part of this update to the community today. I'm Deborah Standridge. I'm the CEO of the Alternate Care Facility, and we're very busy down here at State Fair. That's exactly where we're at, in the exposition hall. You're going to probably hear some construction going on as we provide our update today. We are very humbled and honored to be part of this extension of the healthcare system in Milwaukee and southeastern Wisconsin. We are partnering with all of the healthcare systems, with FEMA, the state of Wisconsin, the county, the city of Milwaukee, the National Guard, the Army Corps of Engineers, and several other external agencies. And importantly, we're partnering with the city of West Allis as well as State Fair Park. So we're very, very grateful to all those partners who are making this alternate care facility become a reality. And I want to stress that we are an extension of the healthcare system. And what Mayor Barrett said is this facility is an insurance policy to ensure that we have adequate number of beds available for patients should the need arise. One thing that we're doing down here and that is under construction right now is creating the facility that initially will open with 530 beds. And we have the ability to go up to over 700 beds if we need to. How a patient we admitted here is directly from the hospital, and it's a patient who is beginning to recover and is COVID positive, but is beginning to recover, and they need extra time to get their energy back, to begin to feel better. Maybe they need some additional oxygen. They need some additional IVs, but they're coming to us to spend a few days to recover while they are transitioning back to home. So that's basically what we are. We are not necessarily a hospital, but we are an extension of the hospital to help them release that pressure valve, if you will, when their bed capacity reaches a maximum. That's what we're here. We hope to open up around April 21st. That's our targeted date, so that we're adequately available to assist our hospital partners when they need us.
Thank you so much, Deborah. And next we're going to hear from Celia Shaughnessy, the Chief Human Resources Officer at the Alternative Care Facility. Celia, there you go.
Yes, I apologize. I was trying to unmute, and now I have background noise.
We're getting a little feedback on you, Celia. Could you maybe for one more time for us, please?
Yes. If you for one moment, I'll switch to where I'm standing.
Okay.
You probably have the sound on both your phone and your computer. You only need one.
Yes, I don't have my phone on.
Oh, there you go.
So I apologize for that.
Oh, there, that was easy. There you just.
Yeah, sometimes musical chairs works well.
Right.
So I'm Celia Shaughnessy, Chief Human Resources Officer for the Alternate Care Facility, and I second Deb's statement. It's an honor to be here. I'm also proud to be part of the Wisconsin and Milwaukee community, as through word of mouth, people have expressed interest in helping in any way can from a staffing perspective. So that is shows that we are that our state and city counties have. So I just want to say that we are at a very critical point in recruiting. We'd like to start our initial orientation on Monday, the 20th. So that is 1 week from now. So we are seeking interested healthcare professionals that are looking to support us. And these are both paid and volunteer positions. So I just want to emphasize that there's opportunities for both. So the best way to do this is to go to the Wisconsin Emergency Assistance Volunteer Registry, and that's short for WEAVR, W-E-A-R. And you will be able to see where there's the best opportunity to sign up specific to the Milwaukee alternate care site. We're looking for both active and retired healthcare professionals and staff. And if you enter your information into this website, it is secure, it's password protected, and it's a web-based registration system that enables my team to very quickly identify you, give you a call, and hope to recruit and onboard you within the next week. Now, with that said, we anticipate that this is ongoing recruiting, given the numbers of staff and professionals that we need to recruit for this facility. Our goal is for Monday to at least be able to staff for the first 100 beds, and then Tuesday continuing to orient as people show interest. And just to be very clear, our staff and professionals here are not intended to place existing healthcare facilities nor pull essential staff from area hospitals. So that's very important. As Mayor Barrett said, this is our insurance policy. We want to make sure that our hospitals and isolation centers are adequately staffed. So we are here to support the existing healthcare facility delivery system. If you are interested and currently employed at one of our local healthcare sites, please check with your employer before applying to help at the alternate care facility. And I just want to emphasize, we're looking for roles like physicians, internal medicine, family practice, emergency medicine, nurse practitioners, physician assistants, ED techs, medical assistants, pharmacists. It is important that we have some nursing leaders that support our, along, of course, our nurses. So if any interested leaders, as well as our RNs, we are looking for you to come on board as quickly as you can.